Hi, everyone. I'm Steve here with Dr. Nario. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right, so we're going to talk about stopping joint pain over 50, especially over 50 when the aches and pains start to creep in. We're going to talk about some peptides. We're going to talk about some supplements. We're going to debunk some supplements that Dr. Nario doesn't think are worth the money, I would say. So here we now. If you guys want to know more about peptides, and there's links in the description for a lot of things that we talk about. So you can see those links in the description. Now, Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online and see all the treatments that they do. They do a lot of IV drips and a lot of different treatments. You'd be surprised. So check them out online. All right. So we're going to talk about joint pain. How about if we debunk the first one that people might think help joints?
Okay. Yeah. So again, a lot of our audience here, I know when they walk up a flight of stairs, your knees are a little bummed up when they sound like they're opening a bag of potato chips. Or maybe you get out of bed in the morning and your hips feel like it's like a formal complaint before your coffee even kicks in. And again, welcome to, I guess, aging. So what we're going to do is healthier aging is what we want to achieve for all of you guys. Or at least that's what we've been told about these specific misnomers. One of the most common questions that I always hear is, what should I take for my joints to be preserved? Or if I have damage, what will it help? Almost everyone answers the same way: glucosamine. So it became like the celebrity supplement of joint health. And if supplements had Hollywood stars, glucosamine would have its probably own walk of fame. But here's the surprise: the supplement that's famous isn't necessarily the supplement that's the best. And that's why we actually we'll discuss this, the specific proofs, medical proofs, why this famous supplement is not as we have perceived it to be, but there are more options for us to take in consideration.
Okay, so you want to get into some good choices?
Yeah. The thing with just to clarify to everyone, that glucosamine really was more of a celebrity. And when I say celebrity, it had I guess, light in the spotlight for the reason that when it came out, it actually was more of marketing that actually pushed it forward. And when I say marketing, this is, well, I don't want to put it in that specific sense, but in Europe, for example, there are actual prescription glucosamines. So these are just not over the counter, and these are the ones that kind of showed us. These are in the early 2000s. This has showed us in like clinical trials, like small clinical trials, that glucosamine is very effective. The thing there is, when they kind of found out about this is suddenly becoming a little bit more inferior than other supplements that came out in the market. And that's why it was just the first one in the market to claim to help for joints. That's why it took the spotlight for that long. It was harder for the other supplements or methods to take it off the pedestal. And it makes sense. Glucosamine is the building block of the cartilage called glycosaminoglycans. And sure, feed the joint what it's made of, which is glucosamine. So it's a very easy marketing ploy to remember for our audience. But as I say, now we have better options.
Okay, so that's not the first one you would try, I take it.
Well, yeah, I mean everyone would, just because Costco probably has a sale, or online they're putting it out there, BOGO deals. But yep, let me tell you, there are more things to consider than that.
All right, so give me one.
Well, here's the thing. Before we even discuss supplements, I have to tell that science consistently shows, so studies have shown, the strongest treatment isn't found in a bottle. It's movement. The American College of Rheumatology consistently recommends strength training, walking, swimming, cycling, and Tai Chi. So Tai Chi is actually one of the best studied exercises for knee arthritis. It's basically slow motion kung fu, as we can see, without having to fight anybody. So, weight loss, exercise, quality sleep, and an anti inflammatory Mediterranean diet consistently outperforms most supplements alone. And supplements should support the foundation, not replace it. So that's basically the number one suggestion I always tell my patients about. But when you talk about supplements, my favorite one, Boswellia. And this is nature's anti-inflammatories. It's known as Indian frankincense. So no, it's not the same frankincense that the wise men brought to baby Jesus, although your knees may think it's a gift. Boswellia blocks inflammatory pathways that damage cartilage. So several modern network meta-analyses actually rank standardized Boswellia extracts among the top natural supplements for reducing pain and stiffness. Typical dosing that I always tell 100 to 300 milligrams per day of standard extracts such as aflopin or 5-loxins, and many patients notice improvement within just a few weeks, not months.
So weeks, huh?
Yep, just weeks. That's definitely a quick one compared to, I mean, glucosamine is I always hear it on TV like a few months, but these guys that I'm going to give some more, they kind of move and they're a little faster.
Okay, so what's that one called?
Boswellia, Boswellia serrata, Indian
And
frankincense.
I guess you can find it online, huh?
Yeah, sure, it's there. I'm sure.
Okay. All right. How about another one?
The next one is our favorite, curcumin, turmeric's superstar ingredient, which is curcumin, as I said, has been compared in studies with NSAIDs or pain medications in multiple studies. Several trials show similar improvements in pain and function without many of the stomach's issues that we worry about with long-term NSAID use. The catch, plain turmeric isn't absorbed very well. So look for bioavailable forms such as Meriva, BCM 95, Longvita, and of course, the dosing around 5,000 to 1,500 milligrams per day. And think of regular turmeric as trying to enter a concert without a ticket. Bioavailable curcumin, of course, gets the VIP pass.
Okay, curcumin. What else? I mean, other supplements, and we're going to get into some peptides too. That's the good stuff. But how about
Mhm.
you got another supplement?
Well, yeah, there's one. So I mean, maybe let's bundle them up. There are two of them. Collagen. So collagen, as we all know, is about rebuilding. And cartilage, there's a lot of collagen in there. As we age, our collagen production naturally declines. Supplementing with collagen peptides or a special form called UC2 collagen can improve joint comfort over several months. And typical doses for UC2 would be 40 milligrams per day, or the more absorbable form of collagen, hydrolyzed collagen, 5 to 10 grams per day. So now here's one supplement many people haven't even heard of. So this is the add-on. It's natural eggshell membrane, or NEM or NEM. Sounds strange, almost it's like inside an omelet, as what you see it and when you crack the egg. But but that's medicine. Surprisingly, randomized clinical trials have shown 500 milligrams of this egg membrane significantly reduces joint pain and stiffness. Sometimes, here's the eye opener, within just 10 days. So newer studies in knee osteoarthritis continues to show improvements in pain, strength, and even functioning. So not bad for something most of us throw in the trash, right?
Hmm.
So eggs are that's a new one. I like that one.
Eggshells.
Eggshells. Don't eat the eggshells. Get the supplement form. Don't be going to the trash and digging up your eggshells.
All right. You got more?
Yeah. Well, let's go into somebody the favorite ones
The
that you
peptides.
mentioned. The peptides. Yeah. So we're not going to be left out without mentioning our favorite peptides here. So
Now,
I'm
they
sure.
just voted,
Uh-huh.
the FDA board just voted and passed, it was like 10 out of 11
Hmm.
peptides to move them back to a level where the compounding pharmacies have more freedom in making them or compounding them. That just happened a couple days ago. And
Oh,
I
really?
bet you, yeah, it did. And well, now I guess the FDA still has to vote on it or
Uh huh.
approve it, but it passed the vote. And I bet you're going to talk about a couple of them that are on that list.
Well, it's about time. Maybe that's what I want to put in there. But yeah, the thing that I want to mention, of course, our famous BPC 157.
On
Again,
it.
and
That's on it.
on it, yep.
TB.
Animal data, as we all know, the strongest evidences that we see for tendon, ligament, and muscles, and even cartilage, very anti-inflammatory, anti-inflammatory, angiogenic, that blood vessel formation. Again, we still need a little bit more studies here, but you would notice here clinically, there's a lot of experience in the good effects of BPC 157, TB 500 again. Systemic tissue repair is the focus, and anti-inflammation actions usually stack with BPC or Wolverine stack in clinical practice. But again, a lot of animal, but we need more human here. And then GHKU copper for sure, which is related to gene modulation, even tissue remodeling. So collagen also is something that it supports in terms of formation.
Right. So
And
that kind of correlates to the one you brought up with the supplements as far as collagen, right?
yeah. So that's why stacking is very important here. Because when you hear about, oh, I just want to use peptides by itself, oh, I just want to use the supplements by itself, you're kind of missing on something if you're just focusing on one thing. So and you're pretty good with that, Steve. I know you have a lot of those experience with stacking, but I have to promote stacking here, even though it gets expensive. Just get the right ones for you. You just have to have the other nutrients around it, not just peptides by itself.
Okay. So what about TB 500? You throw that one in there?
Yeah, TB 500, as I mentioned, that's again very well. I think I mentioned
Beef.
the glow stack
Yeah.
already, and also the Wolverine stack right there. So those are if you want to hit more than one pathway, you definitely want to go with a combo and saves you a lot of injection sites and AOE days.
Yeah, we just talked about that about a week ago, a couple weeks ago maybe, on the two stacks, Glow and Clo, which have all the healing peptides in there. And those are obviously going to help your joint pain, right?
Yep. And that's why again I mean with the injectables in clinical experience, you want to inject this in areas where the injury is or proximate to the injury. Of course, not during the acute inflammation presentation of it, but as you move forward, as you want to recover, you want to deliver that closer to where it is. It might go somewhere else. If you put it in your abdomen, sure, that's still okay. But I'm sure there are so many other inflamed areas of our body we don't know about, which might suck those peptides in rather than going to the direct organ of target.
Right, because it goes to the area that's needed, right?
Yes, that is right.
Well,
Mhm.
especially the BPC.
Yep. They're like
Yeah.
heat-seeking missiles. That's what I call them.
Yeah. Okay. So you talked about exercise. That's really important. You talked about some supplements and some peptides. Do you have any other tips or how do we put this all together? I guess first we want to try to prevent joint pain. And that's where the exercise and eating right comes in, right?
Yeah, of course. When you think about it, really, there's nothing that will beat the basics. Exercise is movement, as you said. Weight management. So here's a fun fact for everyone. Every 1 pound of weight loss reduces 4 pounds of force across your knee. So again, as you would see your dose response benefits exist, even 5 to 10% body weight reduction meaningfully improves pain and function. Another one that don't want to forget, anti-inflammatory diets, the Mediterranean diets, high in vegetable, fruits, olive oil, fatty fish and nuts, and even a lot of autoimmune type of diets. Meaning a lot of inflammatory food sources. And don't forget sleep and stress management. Poor sleep amplifies again pain sensitization, inflammation, and mind body practices such as yoga, tai chi. And I think you're a big promoter of this sleep when you mentioned about the use of your CPAP. So that definitely recharges you real well and lowers down inflammation.
Yeah, I did. I was shocked. You were shocked.
Mm-hmm.
You were surprised too. I was diagnosed with sleep apnea and it's starting to work, but
Yeah, there you go.
Yeah. So we'll see. We'll have to do one on that.
Right.
Because that was a shocker. So you've talked a little bit about preventative, which is huge. Why not just prevent it, try to anyway, because I think in our culture we just wait till something's wrong and then try to fix it. I don't know. I don't think that's the best way. But you mentioned some supplements and so on that will help once we do start to have joint pain. So do you have any last thoughts on how to tie all this up and to just advise for people as they age to increase their productivity and their level of health as they age?
Yeah, well, again, if someone asks me where I can start, I just made sure I lay down the foundation for everyone here. Always move your body, lose excess weight if needed. Again, the diet and sleep, all important. And again, the stacking. Have the good amount of supplements. Quality, not just the simple supplements you buy anywhere, has to be of good quality. And again, everything's personalized and individualized. So, what's the lesson here? Glucosamine, again, I'm not putting bad shade on that. It's just no longer the star player. Modern research suggests several newer supplements, as I mentioned, those ones have greater benefit than that. So don't be fooled by the media hype about getting that BOGO deal for your glucosamine chondroitin. But remember, again, most powerful joint medicine still isn't sold in a bottle. It's movement because motion truly is the lotion in your joints. And people often ask me, doctor, what's the best lubricant for the knees? I tell them walking because unlike the Tin Man, your joints don't need an oil can. They just need you to keep moving every day as much as possible. So avoid that surgery that you're very afraid of.
Yeah, I'll try to do that. All right. Dr. Nario, as always, thank you for being with us and thank you for your insight.
Thank you, Steve, for having me again. As we all know that our knowledge is your power to better health. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.